of 1812, America saw a period of peace and prosperity that ushered in the first Industrial Revolution. This promoted population growth in the northern cities as an increase of immigrants and civil population came into the cities. 80% of the population cities were working class. This meant that they worked in factories or in the home or as servants or in laundries and such. Living conditions became crowded, and there was an increase in the spread of disease and injuries. The period of economical growth and population increase also allowed for the age of reform. Voting rights were expanded, and certain qualifications for voting, such as land ownership, were abolished. Voters began to directly elect government officials, and voting among all classes of white men greatly increased. This new voting presence sought to improve social living standards through reform. The American Civil War brought an end to the age of reform. The country was divided and war-torn, but this also allowed for a medical reform, and such that the need for sanitary conditions and more medical training was seen. In the end, slavery was abolished, and this rejuvenated the age of reform. After the Civil War, the new Republican Party sought to implement a more democratic government in the South. They did so by instituting new state constitutions, expanding women's rights, and expanding civil rights in general. The Second Industrial Revolution came in the last 2 decades of the 19th century. It was driven by raw material and technological advances in communication and railroad. There was another mass influx of immigrants into the cities as they continue to expand. There's also an increase in labor laws and technological advances, which allowed for an increase in job opportunities for women.
In the early 19th century, training did not exist for nurses. Dix was previously an educator who then became a nurse after visiting a prison. With no formal training, she still became a leader in modernizing nursing. Nursing was also not a respected position at this time. The profession was looked down on, especially if you were a female. It was said to only be for those incompetent. According to the University of Glasgow, a significant medical history, the intimate body services to be done for a patient were considered to be unseemly or immodest for a young, unmarried, or well-bred female, especially if not a family member. Cleaning and feeding were domestic tasks to be performed by servants. So home services were also very common. They were more common than going to a hospital for an illness. Few hospitals and few medically trained individuals existed at this time. At-home care was usually provided by a family doctor or a female family member. Gender inequality was a big thing at this time as well. Dix fought to break the social norms regarding women in nursing. She became the superintendent of Union Army nurses in a time when male doctors and male nurses dominated. In the 1860s, formal training became available for nurses. The training schools began producing educated women who were eagerly sought out by hospital authorities, whose medical officers were demanding a higher level of nursing.
Dorothea Dix was born April 4, 1802, to Joseph Dix, a Methodist preacher, and Mary Bigelow. Joseph Dix was quite abusive to Dorothy growing up, and her mother battled bouts of depression, so because of this, at age 12, she moved in with a grandmother in Boston, Massachusetts. So at age 14, she began teaching the well-to-do children in the area, having been taught only to read and write by her father, Joseph, then began taking the poor and neglected children in and began teaching them. A series of health problems caused her to put her teaching career on hold, so she began writing books and stories for children. Dix suffered many health issues. To alleviate some of those concerns, she was told to take a trip to Europe. It was there she became passionate about mental health reform.
Dorothea Dix is best remembered for her efforts fighting for the rights and proper treatment of the mentally ill. During the early to mid-19th century, Dix became appalled by the conditions of a county jail in Springfield, Illinois, and was further surprised when she found out that they weren't incarcerating the criminal, but instead what they referred to as one insane man. Following this realization of Dix, she started advocating for the mentally ill. She aimed to teach the difference between holistic care and custodialism. Prior to her efforts, custodialism was prominent when treating the mentally ill. This was a way to guard, protect, and isolate them from the public. She wanted to teach the holistic approach and teach people that they were able to be cured and managed. They were not their disease, but that they were people, so needed to be treated as people. During her lifetime, mental hospitals specialized to treat those mentally ill were established to address the needs of those affected. One in particular, named after Dix, Dorothy Dix's Hospital on Dix Hill, opened in 1856 in Raleigh, North Carolina. This institution recently shut down in 2012 due to prominent health reforms and political reforms over the years. However, mental health is still prominent due to the efforts of Dorothy Dix.
Today in the United States, nearly 1 in 5 adults experience mental illness. Dorothea's efforts help to shape how these patients are treated today. Recently, there has been an increase in public awareness and acceptance of mental illness all across the world. However, only 25% of adults that experience symptoms believe that people are caring and sympathetic to people with mental illness. As healthcare providers, we can continue Dorothea's efforts to ensure that these patients feel cared for.